Hi, welcome to this beautiful world. We are in Sohyang block of East Khasi Hills district of Meghalaya. We see a group of women discussing seriously. Who are they? This is Mrs. Erwamaya, block project manager of Meghalaya State Rural Livelihood Society, MSRLS. She leads a small team for community mobilization and women empowerment in the block. Her stalwarts are her cluster coordinators. The women we see are leaders from the self-help groups, SHG institutions, mobilized by MSRLS. The women speaking one by one, looks very confident and committed. They are from the three-tier structure of SHG institutions, the SHGs, their village organization, their first-level federation and the CLF, their second-level federation called cluster-level federation. Today, the MSRLS district team leader, Ms. Legit, also has joined. Topic of discussion is, FNHW, that stands for food, nutrition, health, water, and sanitation. Food is the basic necessity of life. And the women present are well aware of that. However, food security is a problem, for some of the most vulnerable people in their villages. So, the women discuss about the public distribution system called ration. They are also seriously concerned about the malnutrition prevalent among women and children. Their concern is that majority of women, especially pregnant women, are malnourished and even anemic. Rates of maternal deaths, MMR, and neonatal deaths, IMR, and cases of malnutrition were high in the state. Meghalaya government evolved a health policy in the year 2021 to address issues related to health on a priority basis. Preventive and enabling health cares were given equal importance to curative care under this policy. Realizing the complexity of the problems in health in the context of Meghalaya, which was much different from rest of the country, the government has approached the problem differently. Under the leadership of Mr. Sampat Kumar, Principal Secretary Health and Social Welfare, a new approach called Problem-Driven Iterative Adaptation, PDIA, has started challenging default solutions. Problems are broken down into smaller ones to identify the grassroots causes. Once root causes are identified, adaptable solutions, fitting to the context, are searched for, and then actions based on that are initiated. Government started taking many unique and innovative steps like Chief Minister's Safe Motherhood Scheme and the Transit Homes, Early Childhood Development Mission, Village Health Councils etc., convergence of National Health Mission, Women and Child Development Department, and Health and Social Development Department, has also been ensured. What is the role of community in implementing Meghalaya health policy and the PDIA approach? Preventive and enabling health have been give equal focus with curative health, and the main solution lay in creating health-seeking behaviors in community. This was not possible without total involvement of community. MSRLS considers the empowered women of SHGs as the best resource to make this happen. A unique cadre of women leaders, called the Community Gender and Health Activists, CGHs, have been established and trained by MSRLS to function as grassroots point person for health. Each village organization selects one active SHG member with leadership qualities as a CGHA. Her role: provide leadership for health behavior change in her village. The district and block teams of MSRLS, under the leadership of Mrs. Memorial Kermaki, its state mission manager, nurtured well the CGHAs as committed resource persons. The women have just taken a pledge to give leadership, to stop maternal and neonatal deaths, and malnutrition in their villages. Yes, they have the clarity as well as sense of purpose. They have understood PDIA, in its most elementary form. What is it? It means, local problem solving. Local solutions for local problems. Maternal nutrition is a key solution. Their leadership role is, make people care. It comes through self-help and community action. It is possible. Miss Legit is explaining things in detail. They make plans for next day's program. They want to do a community baby shower program by inviting the pregnant mothers of their village. They want to make them happy, and then tell them the importance of maternal nutrition and care during pregnancy. On day 2, they have called adolescent girls and young women from the village to their thoughts sharing program. Why inclusion of adolescents? Adolescents who were supposed to become the future human capital, healthy and wise, essential for a developed state. Currently, adolescents lack the cognitive and emotional maturity to make wise and healthy decisions, let alone understand their sexuality, making them unprepared to cope with the consequences of sexual activity. It was reported that Meghalaya struggled with teenage pregnancy and child marriage at rates higher than the national average. Understanding the risks of early marriage and teenage pregnancy was crucial for the young women. Malnutrition and anemia among adolescents were very high. Gender discrimination and gender-based violence were major issues. All these had long-term impact on health, education, and employment in society. Women explain the menstrual and reproductive processes nicely, with the help of a diagram of a uterus, drawn on an apron. How to maintain hygiene, importance of nutrition, risks of early marriage and teenage pregnancy, etc. were shared. These were well received by the girls. GAs appreciated the idea of forming at least one adolescence group in every village, and engaging constantly with the above thoughts. Mothers felt that unlike them, who were learning about health only now, late in their life, their children should learn these things in their early life. Collective learning and actions through these groups will empower them to build a society free of gender discrimination. These girls can become the change and the future too. Now it was the time for the baby shower program. The headman of the village and his wife were also present. The pregnant women were counseled, blessed, and a happiness song was also sung by the women. They gifted samples of diverse food items that would give sufficient nutrition need for a pregnant woman. They reminded that the women should take a balanced diet, supplemented by regular intake of iron and calcium tablets. They also spoke about having a kitchen garden at every home. Happy mother, happy child. The mothers should remain healthy and tension-free for safe delivery and safe motherhood. That was the message they wanted to give. CGHAs also shared some important cares to be followed by the mothers after delivery. The headman spoke how important it was for the mothers to follow recommended practices in pregnancy care, regular ANC check UPS and go to hospital for delivery. He reminded that it was the responsibility of the men too to take care. The headman is also the head of the village health council, yet another innovation in the state. After the baby shower program, the women leaders moved to a nearby home. This is the home of a newly delivered mother. The women have gathered here to demonstrate kangaroo mother care. They now know that one most important local solution which they can learn and practice easily to protect the neonatal child is kangaroo mother care. Yes. Happy mothers, happy children. They have a purpose and a sense of service. They are committed. Change is not far away. They have plans to make their block a Model 1 in FNHW. No more maternal deaths, no more neonatal deaths, no more malnutrition in their villages. Thanks to the leadership of women of SHGs, the demand for health services in the state has increased substantially. The PDIA-based solutions in Meghalaya, introduced by Health Department, National Health Mission and ICDS, and the successful involvement of community by MSRLS, have yielded results. Interim report says that there has been substantial reduction in maternal and neonatal deaths in the state during the 2-year period of 2020 to 2022. What is the unique thing happening in Meghalaya? It is a concerted effort for universal coverage of health. Let us wish Mr. Sampath Kumar and his team in the various government departments, and the MSRLS all success, in this unique problem-solving approach. Let us join together and wish all the best to these committed women leaders of SHGs in Sohyang Block, and also all the other blocks of the state. They are the champions and facilitators of grassroots problem solving. Happy viewing. Goodbye.